Welcome to Impactful Chats. I'm Malin Martinez.
And I'm Seth Truger.
And today we're chatting with Dr. Laura Zimmermann, an assistant professor in the Department of Preventive Medicine at Rush University Medical Center, and actually one of our Impact co-founders. Welcome, Laura.
Thank you.
And so you're here today as a mother to a 3-year-old and an 8-year-old, but also as a physician who's been outspoken about the safe reopening of schools. So tell us first what the pandemic has been like in your household with young children.
Sure. So like many families around the United States, things have been challenging to say the least. My husband and I both work full-time jobs that are typically not 40 hours. They typically exceed 40 hours. Both of my children previously were enrolled in a lot of activities outside the home. So preschool, daycare, elementary school, after school, park district programs, and we have our parents nearby. And so they've also been helping us out with childcare. The pandemic has meant that all of those different sources of childcare and also education and growth and development opportunities for our children have gone away for the time being. And we've been lucky enough to keep our jobs. And we're lucky enough to have jobs with some ability so that we are working from home at least part of the time. So we've really just been piecing it together. Basically, we are now, seeing and taking care of our children 24/7. We've been doing remote learning with our second grader, which is a minimum of 5 hours per day commitment. We've also been potty training our 3-year-old. And my husband, because his job is a bit more flexible than mine, has been taking over the majority of care during the day and then shifting a lot of his work to nights and weekends. We do a lot of scheduling of things during nap time. So we've really, our entire life has been readjusted to the pandemic.
Yep. Unfortunately, that all sounds very familiar. So how do your kids feel about going back to school, and how do you feel about them going back to school?
Well, our kids are pumped. And actually, my 8-year-old is already back at his day camp. Losing out on his friends, his time to socialize and run around was really pretty devastating when the pandemic hit, so to speak. And so he's actually back at a summer day camp where they've been doing a lot around infection control. They've been distancing, they wear masks, they're cohorted. We can go into some of the different techniques that day camps, daycares, and schools are being called upon to do as they reopen in the fall. But he's very excited about it. I am very comfortable with where he's at right now because it's small groups of children. It's a relatively small program, and I know that they are following CDC guidelines. I know that they're following science-based practices to prevent viral transmission. And so far, there have been no cases, and we're about 4 weeks into the day camp.
I see. So can you describe a little bit where local versus state versus federal plans are right now with regard to reopening K through 12 schools?
Absolutely. So nationally, the CDC came out with recommendations earlier in the summer for camps, daycares, schools, and these recommendations largely mirror what we're doing in clinical practice in terms of screening for symptoms, temperature checks, distancing, universal masking. And so those guidelines were put out relatively early in the season, so to speak. At a state level, all states have now issued plans for reopening. The state plans are largely guidance and are not necessarily policy or law. What is really going to have teeth are going to be the plans that the individual districts come up with. And depending on where you are in the nation, or even parts of various parts of different states are in different stages of their reopening plans. So at this point in Illinois and around the Chicagoland area, many places have come out with whether or not they will have any in-person instruction. And this is varying district to district. Some are having completely remote for certain grades. Some are having hybrid plans where the students come in 2 days a week. They basically split the kids into 2 groups. the first group comes in 2 days a week. Everyone's home Wednesday while they clean the school, and the second group comes in the second 2 days. There are other schools, particularly private schools, that are planning for in-person reopening 100% of the time, or 5 days a week. So it's sort of all over the board at this point. And in a lot of cases, the only real decision that's been made is whether or not and to what extent remote versus in-person learning is going to be incorporated.
So what metrics would you say we need to meet in order to safely reopen? And what kind of challenges do we still have that we haven't met that we need to get to open safely?
Absolutely. So as you know, the reopening of schools is a very complex discussion, very multifaceted. Schools and educators are used to dealing with, of course, education is a priority, clearly. But with students, you're also talking about social emotional wellness. You're talking about physical safety, socialization, right? Learning to be part of a community, learning to be part of a society. You're also trying to prioritize things like food security, equity. We know that schools provide some of the only stable nutrition that many children receive during the day through, things like breakfast programs, free lunch programs, free and reduced, et cetera. So I think the education system is very used to dealing with this multifaceted perspective. Right now, I think what remains to be seen is fully developed plans for infection control. I think that's the thing that, as physicians, we can really help our educator partners get a handle on. And so I think some of the things that need to happen are the things that are happening on a small scale for smaller organizations right now, like daycares for essential workers or the day camps that have reopened. I think we need masking, we need enhanced hygiene, hand hygiene. We need to be, screening all students for symptoms, screening them for temperature before they come into the building. We need to have restrictions on visitors. So we're doing curbside drop off and pickup so that no parents go into the building. We need cohorting. We need to have our students in small groups. And the cohorting doesn't just mean small groups. It means that group of students uses the same space all day. They do all activities together. They don't interact with other cohorts. So these are the kinds of things that we need to be able to do in order to safely reopen schools. This is going to be challenging. We already know from Chicago Public Schools that there's a concern that they simply don't have the space to do this. And even pre-pandemic, we know that a lot of the student-teacher ratios in large urban districts was not ideal. So at this point, we need more space, we need more teachers, and it's unclear how we're going to get there. So those are some of the big considerations. Of course, we have to balance this with equity. So, the only way that remote learning works is if a child has a safe space to learn in. Typically for those particularly below high school, but even some high school students, when I talk to my educator friends, they need parents there to help them do the remote learning. The other thing you need for remote learning is an internet connection. You also need a device. So, we know even from the short time the schools were closed at the end of this past semester, for instance, Los Angeles Unified School District knows that 20% of their children never even logged in to remote learning. So I think we have some serious challenges to balance here in terms of equity. There are also school districts that are well-resourced around the Chicago area that are literally sending home devices and internet hubs with children who need them, which is something that is probably not going to be possible for Chicago public schools, for instance. So there are a lot of factors at play here.
So there's been a lot of discussion in the media about parents being sort of opposed to their kids wearing masks all day in school. What are your thoughts on that?
Well, initially, I think we all thought masking in school and getting our children to wear masks was going to be, was not going to be possible. But it turns out that actually my 2-year-old and my 8-year-old are able to wear masks for prolonged periods of time, and they do great with it. And I think if we're really serious about protecting our children and our teachers, honestly, if we're serious about protecting our children, our teachers, and families, and honestly community members across the country, we need to have masks in school. Masks are an effective way to prevent transmission of COVID-19. More and more data are emerging that suggest this. And masks they're inexpensive. It's a simple, extremely low, if not no risk intervention that is going to allow us to keep schools open. So masks, I think masks are essential in schools. And there is a group called the Million Unmasked March, which is trying to garner support to protest the mandatory mask policy at schools. And I think this is a huge mistake. We actually wrote a letter, the members of IMPACT and myself wrote a letter. We have 500 healthcare workers around Illinois who co-signed this letter, and we were able to deliver it to our Illinois superintendent and other Illinois lawmakers, urging them to keep their policy for mandatory masks in schools. This is critical. And we're actually seeing this debate crop up around the country. I've been in conversation with doctors in Florida who are using our letter to also petition their own state policy and lawmakers. And I think this is critical. I mean, kids will and do wear masks, and masking does decrease transmission of viruses. And several professional societies agree with this and endorse this. And in fact, even the CDC has said that masking is one of our most powerful tools to curb this pandemic. So I absolutely agree with masking in school, and I think we have to do everything we can to make that happen.
Yeah, well, thanks. That was a really great summary. I appreciate your input on this, and thank you for joining us on Impactful Chats.
Sure, thanks for having me.
Take care.